It's a chronic disease that can appear quickly, with symptoms so debilitating that even the most basic daily routines can be tough to perform. It's the inflammatory bowel disease, ulcerative colitis. Ulcerative colitis is an idiopathic disease, meaning its root cause has yet to be discovered. What is known, however, is that inflammation settles in the area of the colon. Ulcerative colitis usually affects one continuous part of the inner lining of the colon and rectum. Inflammation in this lining creates the formation of ulcers, therefore ulcerative colitis. As Dr. Cohen explains, inflammation is created when the body's immune system mysteriously attacks the colon.
Your white blood cells are supposed to protect you from infection or get rid of foreign invaders. And when trouble is found, the white blood cells send out the alarm, and the body then pours in more and more white blood cells to the target. Well, in ulcerative colitis, for some reason, the white blood cells start attacking your own colon, and they release chemicals that destroy the cells in the inside lining of the colon. Those are where the ulcers come from.
Ulcerative colitis presents in one particular way in everybody, which is seeing blood in your stool or your bowel movements. What comes with the blood is a sense of urgency, or the sense that you always have to go, and that's because you're getting false alarms from your inflamed rectum. So one way to think about ulcerative colitis is that the inflammatory system of the large intestine is turned on, and your body's having trouble figuring out how to turn it off.
It's been estimated that there are perhaps 500,000 to maybe 700,000 patients with ulcerative colitis in the United States.
It's a condition that is often diagnosed in younger people, but older individuals can have it as well. And it most often is a chronic condition, which means people, once they're diagnosed, will have it for the rest of their lives.
The first step in dealing with the extreme symptoms of ulcerative colitis begins with properly diagnosing the disease itself.
The gold standard for diagnosing ulcerative colitis would be a sigmoidoscopy or a colonoscopy. And we're able to see inflammation through the scope, and then we're able to take tiny pieces of tissue called biopsies through the scope to confirm the diagnosis under the microscope, where we will see these inflammatory changes.
After a diagnosis, ulcerative colitis can be ranked in one of 3 degrees of intensity: mild, moderate, and severe. In mild ulcerative colitis, the inner lining of the large intestine is slightly red and textured, but no noticeable ulcers are present. Mild disease is generally associated with 1 or 2 stools more than normal per day. A moderate ranking would show small inflamed ulcers and be accompanied by 3 to 4 stools more than normal. And in a severe condition, ulcers are large, inflamed, and bleeding, with 5 or more stools per day.
When somebody has ulcerative colitis, there are many troubling, debilitating, and serious symptoms that greatly affect our patients' quality of life. People can lose weight, people become malnourished, people can become dehydrated from the diarrhea, people can become anemic from losing blood through their gastrointestinal tract, which compounds the fatigue that they have.
Isolating the root cause of ulcerative colitis has long been at the forefront of research for inflammatory bowel diseases. And although a lot has been accomplished, more work remains in being able to pinpoint the elusive source of this medical mystery. So what does cause ulcerative colitis? Although currently no exact reason has been discovered, there are many studies underway to resolve this mystery.
The theories that we're working on is, number one, we know that there are genes involved in this disease.
It's more than genetics. It's genetics plus the environment, plus some other trigger that together lead to this uncontrolled inflammatory condition. A disease that's confined to the large intestine might be caused, or at least driven in part, by all those bacteria that are there. So it seems to suggest that. But we haven't found the bacteria that's doing it, or the virus, or whatever organism might be driving this in these individuals. We haven't discovered it yet. And there have been many studies to try and find this.
I think the best research in microbiology and inflammation has probably suggested that it's not one cause, but there are perhaps some type of insult, injury that is done perhaps to the bowel that all of a sudden sets this person who may have a genetic reason to start attacking their own bowel.
While research for an actual cause of ulcerative colitis continues, medical treatments play an important role in helping patients manage their symptoms. There are many approved therapies, and they vary in their approach to treatment. Getting people into remission and keeping them symptom-free are important goals of treatment. For many patients, this may require regular treatments with therapeutics. As with most any medical therapy, side effects can result for some individuals. It's important, however, for patients whose symptoms may not be controlled to understand that when initial therapies fail to reduce the daily number of stools or abdominal pain, for example, different therapeutic options may need to be considered.
Fortunately, with ulcerative colitis, most patients will do quite well with medical therapy.
For those patients whose ulcerative colitis is not responding to current medications, surgery is an option. Be sure to consult with your doctor regarding all of your treatment options.
Surgery isn't perfect as well, which is why we're working so hard to develop better and safer medical treatments for this disease.
Patients who live with ongoing insufficiently treated, or for that matter, undiagnosed ulcerative colitis can result in more complications. So when the disease is ongoing with active inflammation, it causes more destruction and injury to the bowel wall and makes it harder to treat.
To ensure that treatment goals are being met, patients are encouraged to keep a diary of active symptoms and medications, including the number of daily stools and severity of abdominal pain. Patients should review the diary with their physicians every few months or in the event of a flare. Some patients will have repeat symptoms or flares. When that happens, it's very important that they see their doctor right away. And as we've said, it's also important for patients to be actively engaged in their medical care from the very start of their symptoms. The more you know about ulcerative colitis before seeing your doctor, the more you can ask questions that will help you understand your condition more clearly. It can also be a good first step in establishing open communications with your doctor. To answer any specific questions you may have, be sure to contact your healthcare provider.